So today we're going to talk about post-surgery care after cosmetic surgery and what makes the experience at Austin-Weston a little bit different and why we think that's important. This practice has been in place for 40 years and we've seen just about everything that you can imagine in 40 years time. And so our process has really honed that down. You know, if someone has an issue or really they have a suggestion moving forward, like a past patient has had a tummy tuck and they give us some feedback on things that would make the process smoother, it gets a little more refined. And the next time someone else gives us some feedback, it gets a little more refined. And as you can imagine, after 40 years, it's a pretty streamlined process. Everything is done here. So we see you here for your consultation. Your procedure is performed here in one of our AAA HC certified operating rooms. All of your post-op care is done here. Our photos, I mean, literally everything is done here in the building. And so all of these people that are here to take care of you are our employees. It's not like when you go to the hospital and you might have nurses and scrub techs and things that you don't work with as frequently or that you don't employ. That's not a concern here. I think it makes a big difference in the long term. Doing it all here in one location really makes it a safer facility and better for patient care. Another important thing is that we just do cosmetic surgery. So all of our staff is trained in taking care of cosmetic surgery patients, and they are really good at teaching families. And so while we're in the operating room, because our operating rooms are in the same building, while I'm in the operating room taking care of the patient, one of our support staff or nurses is taking care of the family. And so they're having a conversation with them about everything they can expect, how to take care of things at home, how everything will be fitting, just all the ins and outs. By the time the operation is over and the person's ready to go home, the patient's ready to go home, the support person is ready to take care of them. And that would be really, really hard to do if it wasn't all under one roof. While there's a lot of detail in some of these post-operative instructions, I will say that they're very important. Nothing is in there that hasn't been thought through, and we ask that you follow it to a T. While we're going to do everything perfectly in the operating room that we can do to give you the best outcome, the post-operative process, the things you do at home and the things that we've outlined for you in terms of garments and post-operative care is part of the result. And following that protocol gives you the best chance of having the best possible result.